Here we're going to be looking at some of the intercostal muscles as well as some of the flank or abdominal wall muscles. One thing to notice about these muscles is that the fibers are going to be oriented in similar directions between both the intercostal and abdominal muscles. What I mean by that is the most superficial layer of intercostal muscles is going to be the external intercostal muscles, and those fibers are running in a caudo-ventral orientation. Okay? Another muscle whose fibers run in the caudo-ventral orientation is going to be the external abdominal oblique. So, to summarize again, the external intercostal muscles and the muscle fibers of the external abdominal oblique, those fibers run in a caudo-ventral orientation. Opposite to that, if you look here, kind of farther down or ventrally on the rib cage, you will see some fibers that are running in a cranio-ventral direction. You see those all along here. Those are the internal intercostal muscles. You would also see them if you were to remove a chunk of the external intercostal up here more dorsally along the rib. Those cranio-ventrally oriented muscle fibers on the internal intercostal will look very similar to the cranio-ventrally oriented muscle fibers of the internal abdominal oblique muscle. Okay? So, the muscle fibers of the internal abdominal oblique as well as the muscle fibers of the internal intercostal muscles are going to run in a cranio-ventral orientation. Now, the deepest layer of the abdominal wall is going to be the transversus abdominis muscle, and these muscle fibers are going to run transversely, aka pretty much in a dorso-ventral orientation. Another way that you can identify the transversus abdominis muscle is the presence of these very distinct nerves running over top or superficial to this muscle layer. The final muscle that we will see along the abdomen is going to be this muscle right here that's running in a craniocaudal orientation, and that is going to be the rectus abdominis muscle.